Having access to safe drinking water and sanitation is central to living life with dignity and upholding human rights. People living with disabilities, the elderly, and those living with chronic illness face a number of physical, institutional, and attitudinal barriers when accessing the available water, sanitation, and hygiene facilities. Majorities spend their lives marginalized by society and deprived of human dignity. Oftentimes, they face rough terrain such as uneven slopes to reach water sources and sanitation facilities. Day by day, many struggle to maintain the minimum levels of personal hygiene. The rights to water and sanitation require that these services should be available, accessible, safe, acceptable, and affordable for all without discrimination. In Uganda, WaterAid, in collaboration with the Leonard Cheshire Disability, Water.Engineering and Development Centre, and the Appropriate Technology Centre are implementing the Undoing Inequity, water, sanitation and hygiene programs that deliver for all research projects in the district of Amuria and Katakwi of northeastern Uganda.
Undoing Inequity research is about understanding the challenges or dilemmas faced by the vulnerable people, that is the disabled, the elderly, the chronically ill, in accessing water, hygiene and sanitation facilities. The partners in this research will work closely with the communities to come up with inclusive approach that will embrace all categories of vulnerable people.
At community level, the project is implemented by Church of Uganda Teso Diocese Development Office, WEDA Development Agency, together with the Amuria and Katakwi district local governments. This project has generated evidence on how limited access to safe water, sanitation and hygiene impacts the lives of people living with disabilities, the elderly, and those living with a chronic illness. Evidence from the study is then used to influence key policymakers to mainstream inclusive water and sanitation within development.
We use the data for evidence-based advocacy, disseminated it widely to the government ministries concerned, for example, Ministry of Water, Ministry of Education, Ministry of Health, and also try to bring on board the NGOs working for the plight of the disabled, that is NUDIPO, ADD, and universities like Chambogo University, specifically the Special Needs Department.
The project implementing partners carried out accessibility audits with vulnerable members of the community to understand the barriers they face. Using feedback from these audits, the project team, together with the community members, developed accessible latrines and bath shelter options using simple low-cost adaptations which are readily available in the community. The early impact the project has had on the lives of the vulnerable people is evident.
As you can see, Annette Florence, an expectant mother, constructed a raised platform to help reduce the stress she used to undergo while bathing.
Apero kwani ngalongo kwani ebwa mambo ngapera akukumu no kwani ka jarbi along kwani kwani patani kiti do kwani ngoda.
She doesn't have to squat again to help herself, actually to clean herself. Long can you run? She now finds it so easy, at least she can now shower twice a day.
With improved access to inclusive water, sanitation and hygiene facilities, people living with disabilities are no longer a burden to their families. Their dignity has been restored. They can take themselves to the latrines, bathe, and even do a number of household chores. In Bobol village, found in Amuria district, Margaret Among, for the first time in her life, she's able to use a latrine and a bath shelter big enough for the wheelchair to enter.
ta kwana na ya utugoro ation kiteng elongo boya jengo kwapuni before accessing the new bus shelter. Whenever she would want to bathe, she would ensure that she would bathe very early in the morning at around 6 before people come out, and sometimes very late when it is dark in the night because she didn't have a bus shelter. She would just bathe from the veranda. At one point in time, she tried bathing during daytime by the cassava, but she was burnt by a caterpillar, an experience she never liked.
With support from the European Union Water Facility, a local WaterAid Uganda partner NGO had previously constructed a borehole in the village. However, Margaret still faced numerous challenges when collecting water from the water point because it was down the valley. Riding a wheelchair uphill was always tedious, especially without help.
When she's coming from her home, it's a little slopey, but returning, it is hilly. So that gives her sometimes chest pain, back pain, and also the shoulders pain her.
Because of this, Margaret was facilitated to acquire a rainwater harvesting tank. Having easy access to safe water and other sanitation facilities near, Margaret's life changed for the better. Margaret now has ample time to participate in village meetings, as well as to do other household chores, including cleaning her house and plaiting people's hair to earn a living.
We've just been at Margaret Among's house. She has taken us through her journey of change from the time she didn't have access to a latrine, access to a bus shelter, so her privacy was limited. But all this has been possible because she has participated in the entire intervention, and what Margaret has just demonstrated shows that other people who have a similar condition like she has can be able to contribute and be able to access wash facilities at their household. All we need to do is to build on what people have been able to do for themselves and not to just treat them as people who are very helpless, but people with ideas, people who can be part of the whole community, and they will be able to make changes in their lives.
There are some really simple, low-cost options that people can implement themselves that make a really huge difference to disabled people's lives and to their whole family.